English Senior New Speed Start. Honorable members of the Legislative Assembly, Vanakkam. It is a great honor and privilege to deliver my first address to the 16th Legislative Assembly in this August House. This House has a glorious heritage and all of you are proud inheritors in this legacy. I take this opportunity to extend my warm greetings for the new year and Pongal to all members and to the people of Tamilnadu. I wish that this year brings happiness, prosperity, and well being to the people of the state. I would like to congratulate the Honorable Chief Minister Thiru M.K. Stalin for convincing the entire government machinery and effectively managing the second wave of the COVID pandemic by ramping up health infrastructure, ensuring availability of oxygen and essential drugs, and transforming the vaccination drive into a people's movement immediately after assuming office. The government's strategy in successfully containing the second wave without significantly affecting people's livelihood and economy has served as a model for the entire nation. The government has taken intensive measures to increase the coverage of vaccination against COVID. Mega vaccination drives are being conducted on a weekly basis throughout the state. When this government assumed office, the coverage of vaccination was very low, with only 8.09% of the eligible population having been administered the first dose and 2.84% the second dose in just 7 months. Due to the concentrated efforts of this government, the vaccination coverage has been increased to 8.695% for the first dose and 60.71% for the second dose, with a total of 8.55 crore doses being administered. I request the people of Tamil Nadu to continue to cooperate with the government's efforts to ensure success. In the line with the new policy announced by the Honorable Prime Minister on 25th December last year, the state has expanded the vaccination program to cover children in the age group of 15 to 18 years and will provide precaution dose for frontline staff, health workers, and vulnerable sections above 60 years of age. Recently, the Omicron variant of coronavirus has been identified and reported in many states of India, including Tamil Nadu. In order to prevent the spread of this variant, the government has strengthened testing and checking protocols at international airports. Based on the experience gained during the second wave, Tamil Nadu was one of the first states in the country in establishing facilities for genome sequencing. Further, the government is augmenting RT-PCR testing facilities, installing oxygen generating PSA plants, and increasing ICU beds. The government is fully prepared to tackle the new variant and the challenges it poses. The government is providing rupees 25 lakh ex gratia to families of frontline workers who lost their lives due to COVID, and rupees 5 lakh to children who have lost their parents. Further, the Tamil Nadu government has ordered an ex gratia of rupees 50,000 from the state disaster response fund to the kin of persons who have lost their lives due to COVID. So far, relief has been provided to 27432 families. Heeding to the appeal of the Honorable Chief Minister, donations from various quarters have poppered into the Chief Minister's public refund. So far, rupees 5,043 crore has been received since the government assumed office, and rupees 541.5464 crore has been spent towards COVID related activities. The Chief Minister's comprehensive health insurance scheme, which was introduced by Muttamil Arinar Kalaignar, has been expanded, with the annual income ceiling limit being increased from rupees 70,000 to rupees 1,20,000. The government has also extended the insurance scheme to COVID positive patients to avail all types of treatment free of cost in private hospitals. As a result, 33,117 persons have availed treatment worth rupees 387 crore so far. The government has launched a novel scheme of providing health services at the doorsteps of people. மக்களை தேடி மருத்துவம். The scheme was launched with a total outlay of rupees 257 crore to address the increasing incidence of non-communicable diseases such as hypertension and diabetes. So far, 4,299,294 patients have benefited under this scheme. வருமுன் காப்போம் திட்டம், which was launched by Muttamilarinar Kalaignar.